today I'm going to talk, so actually my plan was to talk about this one study that's an empirical positivist epistemology quantitative study on gender and psychedelics about the said mental health improvements. We're also going to actually combine and speak about two different studies on the same topic, but done with very different methodologies and very different epistemological lenses. So hopefully there will be like a chance to compare and contrast, but I haven't done this combo before. So it's an experiment, so bear with me, please. Do I point there, right? Yeah, so my name is Esenia Cassidy. I am based at the Ohio State University at the College of Social Work and Center for Psychedelic Drug Research and Education. So that's where this study was done. Hold on. And so here, when you look at the background, as you may know or have noticed, if you don't know, I'm going to tell you that there is a lack of research in gender and sexual minorities when it comes to psychedelics. So much so that up until this year, if you look, like if you do literature search for gender, psychedelics, and especially with empirical component, there would be nothing that would come up. And so this year, between January and June, 3 papers in a row came up by Kruger and colleagues, Lancelotta and Gogan and colleagues. And there's one more manuscript by me that's under review right now. So it shows that, you know, it emphasizes the gap and how a few people got aware of it at the same time and are trying to fill this research gap. So I feel like I'm in a good company here, and it's really important topic. So we know that due to minority stress, systemic exclusion, stigmatization, gender and sexual minorities, I'm going to refer to them as GSM for brevity, experience higher rates of anxiety and depression, among other, I'm sure, mental health concerns. And so when we come to existing treatments, they either pharmacotherapy or somatic interventions, psychotherapies, lifestyle modifications. However, all of them have limitations, adherence issues, retention issues, and so on. So it's like they, you know, they do exist and they do some sort of a job, but it's not maybe excellent and doesn't work well for everyone. So we are, as a researcher, I'm not happy with the treatments we have in place right now. And specifically when we think about GSM populations, there's like an additional level of those stressors, which we argue makes the predicament of this population even harder because providers often lack cultural competence to work with this population, like experience of kind of like understanding where they come from or utilize cis-normative and heteronormative assumptions and models which don't work for GSM. There's all sorts of discrimination and stigma. You can imagine from microaggression to overt bias to kind of like multifactorial effects that affect well-being of this population. And that together with structural barriers, such as limited access to care, training gaps in providers, and that the providers themselves often don't share the same identity. So it's hard for them to understand the experience of the clients, kind of makes the situation even worse. And so, as we know, psychedelics have demonstrated efficacy in alleviating depression, anxiety symptoms. That's pretty well known, potentially. And while not all the mechanisms of action are completely and explicitly understood, some of them have been supported empirically, some are still speculated, but some of the potential mechanisms are emotional processing, increased psychological flexibility, mystical type experiences, which we talked about today quite a lot. And so we know that potentially psychedelics work, right? That's the kind of ballpark assumption. And for example, in Lancelotta et al. Study right here, in naturalistic psychedelic use study, participants reported significant reductions in depression and anxiety, greater psychological flexibility, and enhanced identity exploration, including self-acceptance and sexual identity exploration. So everything like pointing to the direction of promise for GSM, right? Promise of psychedelic-based treatments for GSM. In addition to that, to quickly finish outlining the sort of the where we are as an environment, most psychedelic research, as we know, most participants are white, educated men, essentially, who are okay financially. Therefore, it limits generalizability to other populations at large and specifically to GSM populations. And this exclusion, we argue, also perpetuates inequities and limits generalizability not just clinically, but also epistemically. And some, like Jay Savellis, have written on it. So we essentially argue for the need for more inclusive research, including GSM, and also for research specifically focusing on alleviating those unique stressors that GSM population faces. And yeah, so our aims in this study were, did we start at 4 exactly? I'm just like trying to keep the time. Anyway, let's assume. Let's 2 past. Thank you. Thanks, Carl. I know, control, I know. So our study aims you to see whether psychedelic phenomenology itself, such as mystical and challenging experiences, emotional breakthroughs, were associated with depression, anxiety symptoms improvement in GSM population, and specifically looked into psychological flexibility, because there is a body of research indicating that the psychological flexibility could be a feasible, important mechanism, sort of to see how that factors into these experiences. Is it work? Because like when I turn here, it sounds different, but here it sounds different. Yeah? Okay, good. Thank you. Thank you. And so so this is a secondary analysis study. So the sample was the same as in Lancelot with colleagues. And so it's an internationally recruited sample of 346 adults who identify as GSM, who had a memorable psychedelic experiences. They were asked to refer to that memorable psychedelic experiences throughout the assessment. It was a very diverse sample. 48% identified as gender expansive, 9 as transgender, and also racially, ethnically diverse. So like we tried to kind of change that big picture. We are so tired of seeing. The measures you can see, excuse me. So in addition to mystical, challenging, and emotional breakthroughs measures, we use the measure of psychological flexibility, psychological insight, and then PHQ-9 for depression and GAD-7 for anxiety. And they showed good to excellent consistency in our data set. And we used a variety of analysis. We used Pearson's correlations, canonical correlation, pair t-tests for pre and post, regression, and mediation analysis. So when it comes to results, we did observe statistically significant reductions in depression and anxiety. Excuse me. I have a bit of sore throat with all the jet lag and travel. So yeah, so most of participants experienced those reductions. They reported them. Effect sizes were large across all measures. And we saw that psychological flexibility itself negatively correlated with depression, anxiety symptomatology. Emotional breakthroughs were also implicated. And also psychological flexibility was a mediator. So it was an outcome of itself, increased psychological flexibility, and it also mediated some of the relationships. I hope the next slide tells us exactly what are the relationships. Yeah, so emotional breakthroughs and mystical type experiences were predictive of reduced depression and anxiety, as we hoped, as we theorized. Challenging experiences, that was a bit mixed. So in some cases, it was linked to improvements, in some to difficulties or distress, which I think only draws more attention to challenging experiences, because the literature as we have it currently doesn't agree, because I would say, I guess, bigger half of the literature indicates that challenging experiences are associated with kind of more benefit, but some literature doesn't. So I feel like as a field, that's a very fascinating, that's a tangent, that's a very fascinating thing we need to look into more. And psychological flexibility, yes, was both an outcome and mediator. And I think this might be it for this study. And yeah, I mean, obviously, it's needless to say, we do call for support for more research with GSM population. targeted development of targeted interventions kind of aimed at GSM populations, which takes into consideration all the additional stressors and the situation in which kind of they exist or we exist. And as for limitations, it was retrospective self-report. There's a bunch of biases. All of us are based in US, which can also be a bias. So there is that, I think. And with this, I'm gonna pivot into a different study that was done before I joined the group at The Ohio State University while I was still at the New School in New York at the Sex Tech Lab, spearheaded by Dr. Pantea Farvid. And this is a qualitative exploratory study done through a very different lens in which we, about which I'll tell you in a second. So I already outlined the gaps in research and that GSM populations essentially are not explored well when it comes to psychedelics. And so you understand the context already. And I think one of our goals in this study was to say that, current focus of psychedelic, almost like a critique of psychedelic research field, we utilize critical theory. So the current focus on efficacy, medicalization, capitalization, and sort of the accompanying lean into those positivist, strictly quantitative methodologies is like taken away from a lot. And for example, such aspects as identity, culture, power dynamics are completely disregarded or thrown out of the window and not focused on enough. And I feel like that's important, not just because of safety, but overall. So this lens is the lens we utilized for this qualitative study. And so that was one of our goals. I think that's a little bit about the gaps. I apologize if that's repetitive because it's essentially like combined two presentations as this experiment last night. And so not to say again how there is not enough research on GSM, we also argue that as a field, we need to be aware of how psychedelic practices obviously take roots in indigenous and non-Western populations, while as a sort of medicalized field of psychedelic research, clinically oriented, capitalization-oriented psychedelic research centers certain voices and also in itself sort of perpetuates the problems of the wider science at large when the very communities where the knowledge comes from are not only sidelined, but also actively punished and persecuted for example, engaging in psychedelic use currently that's outside of this relatively novel medicalized setting. So that was an important part of our approach here. And so we drew from Christine's work here, which was great, and other line researchers. So we conducted key informant interviews, and key informants here were licensed mental health professionals based in the US. So the inclusion criteria was for them to be licensed, based in the US, and have worked with clients who use psychedelics and either use psychedelics to explore their gender identity or use psychedelics and gender identity emerged in the process, right? So that was the criteria. And so recruitment was hard because while anecdotally we are aware of these experiences, there is like a couple of blog posts here and there, people talk at kind of various events, maybe not big, but like smaller community conferences. It was hard to kind of nail down the participants, like the people to whom that happened, who had those explorations. So we chose to go down the key informant route. Because they viewed key informants as like like bearers of this concentrated knowledge because they're subject matter experts. So we spoke with 5 US-based key informants, conducted interviews on Zoom, and utilized Brown and Clark thematic analysis to do our work. And so when it came to demographics, there were sort of interesting parallels, we thought. Because, so out of our 5 key eyes, most were white, 1 was black. They were very diverse in their identities, gender identities, age. They utilized a variety of modalities So I think altogether they mentioned maybe about 10 modalities, and they sort of kind of use them in a client-centered way to kind of draw for what's needed for each specific case or each specific person, which we thought was very nice and creative and robust. And a lot of them worked in private, most of them worked in private practice. And when it came to the clients, which were of course anonymized, so across 5 practitioners, 7 cases we discussed, but cumulatively those practitioners worked with about 16 such clients and also heard from colleagues about this client. So again, like I said, it does happen, but not, I guess, as frequently as it could have been otherwise. Most of them are white and most were in their 30s and identified as trans women, and experienced at least one traumatic event, whether attachment wound or abuse. Also experienced either depression or had an actual diagnosis of major depressive disorder. And psilocybin was the compound in most of the cases, in bigger half of the cases, and ketamine in the second half of the cases. And ayahuasca factored in one of those situations, used as a kind of adjacent remedy. And so here we have the themes that we identified using Brown and Clark approach. And here I'm gonna read the quotes because we feel like as a team it's important. So theme 1 was gender-based rejection, and the pervasive impact of gender-based rejection was very evident to us from the statements from KIs. And we could, so the similar patterns that transpired were that gender-based rejection either took place in the home by parents and family members, so rejection from early age, and later in public by fellow community members. And also there was structural rejection as well. And some of the people experienced both early life rejection and then transphobia, for example, explicit transphobia, which was like a double case of gender-based rejection. And so this first quote, I think, pertains more to the family of origin. There are things that cannot be or are not allowed to be said because they break the family myth and were not permitted in the family of origin. So psychedelics created a special space, allowing the person to help them find their voice, to say the things they have not been able to. So I'm going to skip the second quote for the sake of time, but happy to chat after. Theme 2 is gender role models. And in one case, the participant was referring to, had this very, very vivid memory of their grandmother who was very feminine, and they felt really inspired by that figure in their gender journey based on the mental health professionals' experience. And so here they said, my patient describes their paternal grandmother as someone who they really admired, but reminds me of this wish to become someone beautiful and glamorous, something that spoke to my patient. And so the way they talk about being female is this really strong, burning wish to be like this glamorous kind of 1950s, not quite a peanut, but very, very feminine. And such reference figures were not always positively balanced because I think that's the wrong slide. Interesting. I think we skipped them. Apologies, this makes more sense. And so these figures were not always positively balanced, and for some clients could be like an epitome of everything they resented or feared about a gender, like with this next quote where the clinician said, we never addressed this explicitly, but I felt that a psychotic break that they had brought up this fear of am I gonna turn into my mom? So I think the psychedelics, am I gonna turn into my mom? Am I gonna be psychotic or have alcohol use problem like my mom? So I think that the psychedelics, I kind of have a theory that the gender transition was meant to, this may be how the client put it at one point. They wanted to kill off the girl version of them, the girl identity, the one with the female name. They wanted to kind of destroy that person. It's a very strong language here. And so the KI's intuition was that the client was trying to rewrite their narrative. However, we need to remember that these are mediated insights by the clinicians, and the actual person's experience could have been very different. So the third theme was exploration, seeking exploration and authenticity, where psychedelics allowed the clients to explore life, spirituality, broader terms and themes, and that included gender, such as one QI said that there is the sense of freedom in that space. So it's okay to explore things when you're in that space because you feel a freedom in a different way than when you're just walking about in your everyday life. And so given the rigidity of societal understood gender, I think that was the sort of smoothness and flexibility that the participants, the clients craved. And for some clients, as I mentioned, for some clients, the reason to seek treatment had nothing to do with gender, but once the gender topic emerged, it quickly became paramount and the whole sort of treatment or therapy shifted and focused on gender. But some people did have already some questioning or exploration, like this client here. They had a lot of experience with ketamine before seeing me, and they would use it very specifically to have this low dose sessions with themselves to explore their gender identity. They started at work because they had the sense that there was something going on with their gender, with their assigned gender, like they were performing something rather than authentically walking through the world. They had the sense that they were trans, but they didn't have a space that felt safe to find out more about that, and the ketamine afforded them that. So I think we are maybe about 1 minute away, and I'm just going to quickly go. Thank you, perfect. Over the fourth theme with two sub-themes here. As you see, there were breakthrough moments and self-acceptance and reclamation of agency. And so in one of the cases, for example, here, there was a person who saw themselves in the circle of their female ancestors. So the client who originally identified as male and then was kind of transitioning, was wandering and then transitioned eventually to identifying as female. Apologies, this just fell off. Oh well. And so that acceptance they felt from this circle of their ancestors, they experienced in the psychedelic journey was very meaningful to them and was a like pivoting point, a hinge moment in their journey. And when we get to self-acceptance and reclamation of agency, this was a crucial theme also in reconnection for the clients with their deepened sense of self, and also the profound affirmation and validation associated with that. And again, for some people, it was discovery sort of anew. This was a surprise. And for some people, it was affirmation of, for example, wondering curiosities they already had. And this aligns with our studies, the research on mystical experiences, and then acute psychedelic effects can lead to significant positive identity affirmation. I think Samuel actually wrote about this. And so, yeah, so just to quickly wrap up, I think the main takeaway is that from this specific study, the need for psychedelic and therapeutic interventions, we see that the clients experience those adversities in many cases because of living in a society with very rigid, very binary views on gender. And so they needed psychedelics to recalibrate, to kind of like take a step back from this, to recalibrate and get into more alignment with how they saw themselves, rather than sort of like to kind of get out this noise from society out of their field and get a better, more aligned sense of self. I think that's it. That's me, and happy to chat now and afterwards.
Thank you for the presentation. I have a stupid comment about the first study, because you recruited sexual and gender minorities, and you basically replicated the findings from previous studies that they had like perceived improvements in well-being mediated through psychological flexibility. And you, in your implications, you said that there were some implications about like gender and sexual minorities, but I don't understand. I agree that it's important to study this population specifically, and you saw that the findings basically were replicated in this sample. But what are the implications for minorities and that you mentioned in the implications? I didn't understand how they follow from the results.
So first of all, I don't think it was a direct replication because Alan Davis, who's my supervisor, so they wrote on psychological flexibility, but in different populations before. So we are looking into psychological flexibility in this population, like that's a novel piece, because Lancelotta, for example, the primary analysis paper, they did not look into psychological flexibility. Okay, so yeah, that's one thing, that's not a replication. And how did you formulate about the question about implications, you see?
No, it's this is just the stupid question about I ask you to explain more simply to me what are the implications of this first study?
So I think
yes.
So I think the first one, the quantitative one. So I think there is, I guess, multifold, but I think the main 2 points that interest us is that on one hand, it's like Daniel was like type 1, type A and type B, psychedelic exceptionalism. Implication A is that we need more studies of psychedelics either in specifically GSM populations or when GSM population is like a big part of the recruited sample, because right now there is not much. And out of the 3 studies I mentioned, 2 are naturalistic use, so not a like clinical research trial. And I think so that's one, we need more research. And I think it's related to the type B implication that understanding how that works for GSM individuals in clinical trials, for example, will help develop targeted interventions sort of aimed at, this additional layer of minority stress and stigmatization, exclusion. That's pretty unique to GSM populations, and I'm sure other populations have similar experiences in its own way. So once we know more what's happening, then we can see how that could be expanded beyond the research and how clinical interventions could be aimed, based with psychedelics, aimed at those specific populations. Does this help?
Yeah, thank you.